hallmark of the modern socialism, and also in the process of promoting socialism with Chinese characteristics. We have a lot of health professionals who have put all of their efforts into saving patients and care for the patients in order to provide better health services. And August 19 was the Physicians' Day of China, and we have also selected 4 outstanding representatives from the medical and health department with us today. They are Dr. Yu Jiajun, doctor of Haidao Health Station from Anhui Province, and Dr. Lin Lijhu, director of Lingnan Cancer Research Institute from Guangzhou University of Chinese Medicine, and Dr. Jiang Nan, chief of Cardiac Surgery Department, Tianjin Chest Hospital. Dr. Hou Xinling, chief of Pediatric Medicine from Beijing University First Hospital. And Dr. Deng Baofeng, nurse of the Nursing Department of Beijing Geriatric Hospital. Now let's give the floor to Dr. Lin Jiajun. Dr. Yu Jiajun. Hello everyone, I'm Yu Jiajun. I'm from the Qishan village of Mabu Town, Jinzhai County, Luan City of Anhui Province. And I graduated in 2000, and I gave up my opportunity of becoming a doctor in the city and came back to my hometown and become a village doctor. And for 20 years, I actually work on boats and provide medical services to the islanders so that they don't need to go out to seek for medical assistance. And the health service condition of the island has also been improved, and we now care for the chronological diseases. We also build up health files for the villagers, and we actually have full information of all the health conditions of all the villagers. We also conduct with the villagers, communication with the villagers in a timely manner. I am on call 24/7. If someone calls, I will go to check them out. In the island, when people see me, they will believe that they can be treated, they can be well treated. I think I consider this a matter of myself. I want to do my work well, and I also want to guard the health of the people. Thank you, Dr. Yu. You've been working in the island for 20 years. And this is like a last mile service for all the islanders, all the services. Now let's give the floor to Dr. Lin Lijhu. Hello everyone. I'm from the Cancer Research Institute of the First Affiliate Hospital of Guangzhou University of Chinese Medicine. I've been involved in the teaching and treatment of cancer, and I've been a doctor for 30 years now. And I practice the spirit of Sun Si Miao. I treat all the patients equally, and I do all what I do for the patients. We combine traditional Chinese medicine with the Western medicine and also care for the patients personally. And we've treated more than 100,000 patients. Many of them are of very severe conditions, and they gain hope. an aspiration through the treatment. We try our best to extend their lifespan and improve their living quality. And also, this early detection and screening is key to cancer treatment. So I open up my own workshop and I set up my own media, my own account to do public education so that more and more people can get to know about the treatment and the prevention of cancer. As a senior doctor, I think sometimes I cannot ensure that the patients will enjoy a long life, but I can ensure that they can enjoy a better life while we're still living. So that is my calling. I think it's very good work that you do in terms of the public education sector. Now let's go forward to Dr. Jiang Nan. Hello everyone, I'm from the cardiac surgery department of Tianjin Chest Hospital. We all know that the heart is the most important organ on a human body. It's like an engine of us, and each movement of a heart will bring fresh oxygen and blood to all corners of our body. After graduation in 1987, I've been working in the front line of cardiac treatment and cardiac surgery, and I've witnessed this leap and bound improvement. And we have witnessed some major improvement in this regard. We have undergone major changes in terms of cardiac surgery. Some of the untreated disease cannot be treated. Some of the major trauma, some that involve the opening of a chest, can now be done with a minor trauma. And some of them can even be done through very small intrusions. So this is my calling. I would like to further improve the surgery technique and also build up this platform to involve more young doctors, to encourage them to do innovation. I would also like to help the hospitals, especially the cardiac department in remote areas. Thank you, Dr. Jiang. And next, we'll give the floor to Dr. Hou Xinling. Hello, everyone. I am from Peking University First Hospital, and I also work at the pediatric department, mainly majoring in the brain surgery and brain trauma of the kids. So I also volunteer to work at a hospital in Xizang, in one of the pediatric hospitals there, and I introduce this neurocare treatment to this hospital in Xizang. And I also have received this mission to help a pediatric department in Ningxia. So I took on this job and I worked in many locations in the past years, but my aspiration has never changed. I want to see the kids grow up healthily, and I will stay true to my aspiration and also try to bring a better future for all of the kids. Dr. Hou and her team has also been working with the many experts to help with the local kids from Beijing to Xizang to Ningxia. Hello everyone, I'm Deng Baofeng. I work at the Beijing Geriatric Hospital. I work as a nurse of the nursing department, and I was also involved in the treatment of SARS, the treatment, the aftershock of Wenchuan earthquake, as well as COVID-19. Whether an aged person is at home or at a nursery house or at the hospital, they take special care of them because they will have different habits. They will have trouble sleeping. They will have trouble going to the toilet. We find it difficult to move around, and they will have major danger if they fall. So it takes profound expertise to be a nurse in the pension home, in the nursing department, so that the pensioners, the senior citizens, can feel this warmth and depth of care. I think to take care of the senior is like taking good care of the kids. I think a healthy and also a respectful and decent old-aged life is something that we all pursue. Thank you for your care and special attention that you paid to taking care of the old-aged citizen. Now the floor is open for questions, and please make sure that you identify yourself before raising the question. So you are chosen as the outstanding health professionals. So how do you understand this prize? I think to be a good doctor, you need to be not only good in your techniques, in your expertise, but also you need to have a good heart. Everything is about the patient, and you need to provide services to the patients wholeheartedly, sympathize and empathize with the patients, and address their biggest concerns. In terms of expertise, you must keep on learning, improve yourself. So that you can better help the patient. So as an outstanding health professional should be one with good virtue, a good heart, and high expertise, high level of expertise. I think I learned this concept from the famous Asian Dr. Sun Simiao. To my understanding, when I was working in Xizang and Ningxia, I work with all my colleagues. Sometimes we miss our family, but I think it will facilitate the patients because because we have already traveled. They don't need to travel afar to seek assistance. So I feel very proud of what I've done with my colleagues. That's my understanding. work at the nursery department, the nursing department, and I'm also a representative of my team. I see this as a recognition and encouragement of my team, and also I see it as an encouragement to the nursery services, because it's our traditional virtue to care for the elderly. Me and my team will continue to carry this tradition and virtue. And we will continue to work harder to provide high quality care for the elderly. Thank you. I think it's seemingly an easy question, but actually it's not. As an outstanding professional, you not only need to be proficient, it takes training, it takes learning to develop your expertise and skills. The more you learn, the longer you work, we feel that there's more to explore, there's more to learn. So this kind of learning curve never ends for a doctor. In terms of the morals, or the code of ethics as a doctor, I think it's the foundation for any profession. If a patient lies there, sometimes I ask myself, sometimes I ask my doctors, my students, if it was you who was lying there, what kind of doctor would you like to do the surgery on yourself? So this kind of switch positions will help us to understand what kind of doctors we would like to be. And it's also a boost for us. And I think I will continue what I've been doing for the past decades. I think a spirit of devotion is important. Winning this prize is recognition of the country and the people that I provide services to. I'm only one of the 1.1 million village doctors of our country. I believe that this prize goes to all of them who have been devoted all of their work and efforts to the patients at the villages. Thank you. The question goes to Dr. Hou. In 2016, you voluntarily joined the team to work in Xizang. So any stories that impressed you, and what is your takeaway from this experience? In 2016, the entire Xizang autonomous region has very weak medical base. That's why the central government organized this special delegate to work in Xizang. I met one of the patients who had the trouble breathing, and they have trouble swallowing. But I'm actually not one of an expert in terms of the in terms of this, so we invited experts from this department to do surgery of the patient. This kid is right now already 7 years old. So we are very happy that we changed her life. When I was first in Lhasa, I discovered that one of my little patients would have a very severe bleeding problem if there was a very small trauma at his mouth. We've discovered and also made the diagnosis with my colleague that this was actually the first inborn hemophilia disease. That was the first case that was diagnosed in Xizang. And currently, the hospital that I used to work in has become one of the top hospital in treating hemophilia in Xizang. So that's my answer. I believe that my work is worthwhile. Next question. My question goes to Dr. Deng. You've been working in the nursing department for the elderly for many years. So what do you think is the most important experience? I graduated in 1985. And I've been working for 40 years, almost 40 years now. So nursing is not only a job for me, but also my lifelong career. I've been working in this in this department for so many years, and I've seen many stories. A lot of them suffer from diseases because of old age. And during this process, we have done a lot of discoveries. We have, in order to try to provide better services for the elderly. A lot of these patients would have chronic diseases, some of them more than one type. And these diseases actually intertwine with each other together with their weak physique. So it's not easy to provide services to them. In our practice, we've been inventing new models of services. We have 3 cores. And also we have this evaluation technique. We also conduct cross-disciplinary management and expertise. We've built up a special team to carry out investigation on their syndromes and conduct discussions of clinical diseases and to give this very targeted treatment. And our efforts has been well represented. And in the future, we will provide better services, and so that they can have a better life in their old age. My question goes to Dr. Lin. Not only did you do well in clinical practice as well as as well as research. You also attach importance to public education. Why is that? Why did you choose to do that? As I mentioned, early detection, early diagnosis, and early treatment is key to cancer treatment. In order to realize that, the people need to know more about cancer. Why someone may acquire cancer? What are the typical syndromes at an early stage? Does it have anything to do with genes, genetic factors? That's why I've set up my workshop and also my personal account. And also I publish books and do lectures. One of my books it tells the patients how to self-discover and prevent cancer from happening. And also, it tells you how to adjust your dietary habit. A lot of cancer has to do with your habit of eating. For example, esophagus cancer and intestinal cancer. In traditional Chinese medicine, there's a very important concept that is to treat the disease before it happens. Therefore, it is important for people to change their living habit so as to reduce the cancer risk. Everybody is the first responder of one's health, but they will need specific instructions so as to better guard their own health. So it's our responsibility to improve the level of recognitions among the general public of cancer. You've been working in your job for many decades, many of you. And as a doctor, you deal with life and death every day. So how do you cope with your challenges? And how do you stick to this path of your career? Indeed, I graduated in 1987. I've been worked for 37 years. Because I do cardio surgery every day, the level of risk is actually very high. I face different patients every day, but they will have different syndromes, even if they have the same disease. No any two patients are exactly the same. So before each surgery, we would discuss their treatment and the surgery plan, and also contingency plans must be made beforehand. But there are still some emergencies that may happen during a surgery. As a surgeon, we need to stay calm and stay confident of what you are doing. This confidence is not unfounded. It comes from my daily work, my experience, and my expertise. I talk to the younger patients all the time and share with them my experiences so that they can grow and they can become more proficient. Also, my discipline actually develops very fast, So even if I'm a doctor of more than 30 years, I still need to keep on learning every day. I've been working in the medical industry for 38 years now. So we are one of the first cancer department that was established in China. We are thinking about one question every day: how to treat the patients better. And our department actually features the treatment of traditional Chinese medicine, because the treatment of cancer usually depends heavily on Western medicine, but it has its defects. That's why we introduce this combination of TCM. I think 1 + 1 will be bigger than 2. But to do that, you will need profound knowledge not only of the Chinese medicine, but also modern medicine. In this way, you can talk very clearly to the patients. A lot of the cancer patients and old age will have a lot of complications. So tumor is not the only thing that we think about. We also need to take into consideration their health conditions and their chronic diseases. When students are trying to apply as a PhD candidate, I would tell them that this is a hard job. You need to think about this clearly. You cannot do this with the knowledge of only TCM or only Western medicine, because we're doing this kind of combination. A lot of the patients are well treated in my department, and I also feel proud to see them recover from cancer. I think it is important to feel needed as a doctor, and it is also my drive to go forward. Thank you. I've been working in a nursery department for almost 40 years, and I work in the elderly care department for more than 20 years. I've seen this kind of despair and pain of a lot of the elder people. Some of them, when they come here, they can only lie, they cannot stand up, they cannot walk. But after our care, they can. And that is such a rewarding moment for me, to see them be able to sit, to stand, or even walk again. So my scope of work has always been expanding. I need to stay true to my aspiration and provide better quality services to them and improve their living quality as well. Next question. My question goes to Dr. Lin. Cancer patients are a very special group. What would you like to say to them? And what role can TCM play in the treatment of cancer? Actually, for the cancer survivors, if some of them are at mid or later stage, I think I would like to tell them that the scope or the width of your life is as important as the length of your life. If you cannot live a longer life, you can live a better life. You can expand the scope of your life. In terms of TCM treatment, I think TCM has a more holistic view of the diseases. Therefore, it is important for us to make a targeted plan, a more individualized plan for a patient. For patients that are at mid or late term, we especially need to take a more holistic view. We not only would have to care about the tumor, but also their mental issues and their family issues even, so that we can better understand the patients and provide this individualized health plan for them. Through our treatment, a lot of the patients recover very well. In my treatment center, all of the patients are very optimistic, and we have a very good relations with the patients. That is our goal. We need to expand the scope of their life, improve the quality of their life. I think life is so valuable, but life is also so fragile. We discuss the treatment plans with the patients all the time. You need to take into consideration not only their disease, but also their economic conditions, their income. So, as a senior doctor, I am now leading my team, all of the doctors and nurses, and our work have been well recognized by our patients, and will continue our work in the future. Thank you. My question goes to Dr. Hou. You mentioned that you've worked in the medical aid program to Xizang and Ningxia. You also were involved in the building of a local medical center so as to provide better services to different localities. Can you tell us more about your experiences in this regard? In our medical aid program in Xizang, this is actually a very long-term program of the Pediatric Hospital of Beijing. And we've been working in this program for 9 years now. I think the assistance itself is not the key. The key is to work together to encourage local people. It's like from blood, like a transformation from blood transmission to blood creation, so blood generation. And currently, the building of the medical center in Xizang has been taken effect, and most of the major diseases can be treated, and the local patients do not have to go out of the autonomous region to get treated. And in Ningxia autonomous region, we've made two major breakthroughs. First is to save the distance of travel for the patients. If a patient and their family has to travel afar, it will be a major burden of their physique as well as their economy and their expenses. So I think it's important for the local hospital. It's important to make sure that the treatment is available at more and more local hospitals. This building of regional medical center will help the high quality medical services and medical resources to be expanded to more localities. In my hospital, for example, there are patients that are coming from different provinces. I think this sense of gain has been improved. My question goes to Dr. Jiang. You're a cardio expert. So, how to become a doctor and at the same time become a leader of a team? Thank you. I'm a cardiovascular surgeon, and I do rounds with my colleagues and also work at a clinic. And also, I'm a head of my department. We have 5 divisions, and it had 400 beds. How to manage such a big team, such a big department? It is important for us to build an open and harmonious working atmosphere inside the department. And I also want to encourage the young people to be more creative, to be more intuitive. Because to be honest, I'm about to retire, so the younger doctors must step up. The cardio department is a very unique department. Sometimes a patient cannot be treated by one cardio expert. It takes the synergy of a lot of our colleagues from the neighboring departments, such as nursery, as well as some mental conditions. So I also feel sometimes a very big pressure on my shoulder. My question goes to Dr. Yu. You're working at the health station of the island. Not only do you have to answer to the calls of the patients, but also need to encounter the natural challenges because of the harsh condition, the harsh environment. So how do you cope with the challenges? Yes, I work on an island. I'm surrounded by water. Most of the villagers are actually migrants of a building of a major reservoir. And currently, most of them are senior citizens or people with chronic diseases, mainly cardiovascular diseases, and also some physical aching because of the very humid environment. If we have patients with severe conditions, We will have to try our best to transfer the patients outside the island. For the local residents, we also need to change their living habit so as to reduce the risk of chronic diseases. And whenever I receive a call of a patient, I will row a boat to see the patient 24/7. Some of them I have to travel at night. Sometimes I have to travel at night. Once my boat hit a rock and I almost fell into the water. However, if someone asks for help at night, it's always emergent. So I have to go. And I also have got a driving license for a boat because the traffic is not very convenient. If I go to the town and I will ask if the local villagers would need anything so that I can bring it back. And so everything I do to help the patients and help the villagers to have a better life. Thank you. Thank you for the experience and talks of all of the outstanding health professionals. These are 5 outstanding representatives of our professionals in the medical and health department and industry. You are the guardian of the health of the 1.4 billion people in China. So last but not least, highest respect to all of you. That's all for today's press conference. Thank you.